Myanmar will enter a partial COVID-19 lockdown from tomorrow. The country is facing its worst infection rate, with healthcare stretched to breaking point. The military announced 145 deaths from the virus on Wednesday, and that is the highest toll since the February coup. Liang Wai-kit reports.
This is how quiet the streets of Yangon are. And that's even before the week-long lockdown started nationwide. People don't need to be told how serious the current wave is. For them, it's painfully clear. This video has been circulating online. It shows people waiting to bury or cremate their loved ones who are believed to have died from COVID-19. Aid groups and funeral workers say the country's daily death rate is way higher than what's reported by the authorities every day. Since Myanmar found new COVID-19 variants in mid-June, daily cases and deaths have spiked. To curb the spread, the Myanmar army declared a week-long stay-home order starting Saturday. During that period, people must remain indoors, with the exception of those who need to attend funerals. Shops selling medicine and medical equipment will remain open to the public. But that may not do much to ease the crowds outside shops selling oxygen. People are desperate for it since hospitals are running at full capacity. Many are forced to treat COVID-19 symptoms at home. The Myanmar army had earlier said it banned sales of oxygen to individuals, saying supplies should first go to hospitals and treatment centers. One international aid group says the lack of oxygen in countries with serious COVID-19 outbreaks is not unusual. And Myanmar is no exception.
We can't simply make oxygen appear. So we are looking into ways to increase the import of materials relevant for the COVID treatment. We are in very close contact with the broader international community to see what role the ICRC could play even more due to its particular position.
The country's state media say officials in Yangon had recently talked about making it easier for people to refill their oxygen tanks. The army had also imported more liquid oxygen to Yangon, and there are plans to increase more of such supplies. Despite that, the reality is still grim. Social media posts these days in Myanmar are often filled with people appealing online for oxygen supplies, as well as follow-up posts later saying that there's no need for that anymore because their loved ones have died. I've also spoken to some of my sources who say that it appears the Myanmar army is seizing equipment such as personal protective equipment and medicine at land borders. Now, this comes as pharmacies are already struggling to meet demand for medicines and amid rising prices for these supplies. Liang Wai-kit, CNA.